When someone you love is critically ill, the ICU, well, it becomes the center of your universe. It's an incredible place full of amazing skill, but it's also filled with so much stress and uncertainty. Today, we're going to dig into a really fundamental shift in how we think about the family's role in that high-stakes world. And it all boils down to one simple but really powerful question.
And that question, that really gets to the heart of it all, doesn't it? For so long, families were kind of seen as visitors, waiting anxiously in hallways. But what if the goal wasn't just to let families in, but to make them a core part of the care team?
So, to really understand why this shift is so important, we have to start by appreciating what families are actually going through.
I mean, being the family member of an ICU patient isn't just stressful. It can be genuinely traumatic. You've got the constant worry. You're trying to process all this complex medical information, and you're facing these life or death decisions. It takes a huge toll.
In fact, this experience is so common that it actually has a clinical name, Post-Intensive Care Syndrome Family, or PICS-F. And the numbers here are pretty shocking. We're talking up to 40% of family members are still dealing with serious psychological distress months after their loved one leaves the ICU. This isn't just a side effect. It's a major public health issue that comes right out of that ICU experience. Okay, so how do we fix this? Well, the answer seems to lie in a really key distinction, the difference between just being involved and being truly engaged. And this chart just lays it out perfectly. On the left, you've got involvement. It's passive, right? You get information, maybe they ask you to do a little task, but the communication is basically one way. You're a visitor. But on the right, you have engagement. This is totally different. It's an active, collaborative partnership. It's built on mutual respect, and you have a real say in the decisions. You're not a visitor anymore. You're a true partner. So here's the more official definition that researchers are using. And the words that just jump out to me are intentionally prepare, invite, and empower. True engagement doesn't just happen by accident. It's something the healthcare team has to deliberately build and encourage.
But here's the kicker. A lot of hospitals measure family satisfaction after the fact. They send out a survey asking, hey, how did we do? But that doesn't really tell them if a family was truly engaged in the care process itself. And you know the old saying, you can't improve what you don't measure.
This is where things get really interesting, because there's a new way to measure this that could be a total game changer. So let me introduce you to the work of researcher Morteza Shamazadeh. He's focusing on validating a specific tool called the Family Engagement Measure, or FAME for short. And what's so cool about it is that it's not about measuring fuzzy feelings. It's about measuring the concrete, observable actions that show real engagement is happening. The FAME tool is built around these 7 core ideas. And as you can see, this goes way beyond just being in the room. We're talking about two-way communication, sharing in the decision-making, and even using technology to make that partnership easier. It's a much more complete picture of what it really means to be a partner in care.
Okay, so having a great tool is one thing, but you have to know if it actually works in the real world. So let's talk about how FAME is being put to the test.
Now, FAME was actually developed and first used up in Canada, but the US healthcare system is, well, it's a different beast, right? It's got different structures, different cultures, so you can't just copy and paste this tool. It has to be scientifically validated to make sure it's actually reliable and relevant for American ICUs. The research plan for this is really smart. It's a 3-phase approach. First, they survey hundreds of families to get the hard quantitative data. Step 2, they do these deep dive interviews with both families and clinicians to get the stories, the why behind all those numbers. And finally, they pull it all together, integrating everything to get a complete picture and make the tool even better. So, why go through all this trouble? Why does all this measurement and research actually matter? Well, it's simple, because better data leads directly to better care. And this, right here, is the crucial takeaway. Engaging families isn't just a nice thing to do to make them feel better. It has a real, measurable, clinical impact on patient outcomes. And the data, well, it really speaks for itself. Check this out. One study found that patients who had family present were 3 times less likely to be readmitted to the hospital within 30 days. That's not a small difference. That's a huge, staggering gap that shows a clear link between family partnership and the patient's actual health. So, in the end, having a validated FAME tool basically gives hospitals a roadmap. They can finally measure their performance, see where the gaps are, and make real, tangible improvements. And that means less trauma for families, care that's better aligned with what patients actually want, and finally, a clear path to making family partnership the standard in every ICU, not the exception.
Which leaves us with a really powerful thought to end on. Think about it. We prescribe medications and therapies every single day in the ICU. But what if the most powerful prescription of all was a structured, intentional, and measurable partnership with the family? What could that change for millions of patients and their loved ones every single year?